Now comes the most important part to be discussed in the lecture, which is about the surgical management. So first you need to identify if the tumor is operable or not. Obviously that depends upon the stage of the cancer and the status of metastatic disease. So when you talk about the management, you have to see if there's you can achieve the local control or not. You have to go for appropriate surgery or not. And for achieving the local control and going for the appropriate surgery, the options you have available is like you go for the local resection or a wide local excision with the radiotherapy, go for mastectomy, which is a simple modified radical mastectomy, and depending upon you're going to go for radiotherapy or not, and sometimes you have to combine the mastectomy with the axillary section or axillary clearance as well. Now, if there is a systemic disease, so how are you going to treat the systemic disease? Obviously, the tumor has already been metastasized. So you have to offer the chemotherapy if prognostic factors are poor, or you have to go for hormonal therapy with a Herceptin if the patient is HER2 positive. And the other option is like you go for a radiotherapy. So first you have to identify or you have to be clear if the tumor is operable or not. If the tumor is operable, the options you have is wide local resection combining with radiotherapy, and or the option is go for the radical mastectomy, or the option is do the mastectomy with the combining with the axillary procedures, and later you go for the breast reconstruction with the latissimus dorsi flap or tram flap. And the other option for the systemic disease is like you go for the hormonal status, put on a hormonal therapy, chemotherapy, or go for the radiotherapy. So that's the main algorithm which you have to follow in case of the diseases of the breast cancers. Now, when you talk about the surgical therapy, the options available is local excision, especially this is more common for the benign tumors like the fibroadenoma, and which is palpable lump is there, and you go for local excision, or you which is called as a lumpectomy, or you go for the wide local excision, which is a breast conservation surgery. Like you don't have to take a lot of the breast tissue so that the normal a little bit volume of the tumor, volume of the normal breast should be left intact, and you can go for quadrantectomy if there are actually 4 quadrants of the breast. So if you do any of the surgery in this quadrant, that is called as a quadrantectomy. The other is a radical mastectomy, which was initially the Halsted mastectomy, in which the pec major, whole of the breast tissue, and whole of the pec major and pec minor was taken out. But today we do the Pate radical, modified radical mastectomy, in which you preserve the pec minor and the pec major muscle. Again, modified radical mastectomy, then you have the sentinel lymph node biopsy, or you have the axillary lymph nodal dissection depending upon the levels of the lymph node, axillary level 1, level 2, or level 3 dissection. So generally, we have these surgical options. We will be discussing these one by one. In case of the invasive cancers, first identify the stage of the tumor. If it's a stage 1, 2A or 2B tumor, so you can go for lumpectomy, radiation, lumpectomy or quadrantectomy, radiation therapy, and then you can go for the mastectomy with the axillary staging, or you can go for the breast conservation surgery like the wide local excision of the tumor. In case of stage 3A and 3B tumors, you have to see for the systemic response first. Maybe possible you're going to put the patient on hormonal or chemotherapy, and there would be a reduction of the size of the tumor, and then you can plan accordingly the surgery like quadrantectomy, lumpectomy, or BCS, whatever you can. Okay, so complete or partial responses. If there is a complete or partial response to the systemic therapy, then you go for the surgical therapy, and you do the adjuvant therapy and put the patient for the follow-up. And if in case of stage 3 or 3B tumors, and there is no response to therapy, then you consider the alternative systemic therapy. And if there's still no response to alternative systemic therapy, then obviously you have to go for the palliative surgery. So remember, for the early cancers, as early as tumor is picked up, obviously you have to do a less less invasive surgery, like lumpectomy, cordentectomy, or via local excision. But depending upon the stage of the tumor, you go for the advanced cases, like you go for MRM, modified radical mastectomy, combining with the axillary clients, and if there is fungating mass and it's already been metastasized and there's no response to chemotherapy, all you can do is you can go for the toilet mastectomy. And if you have to see if there's a response to the hormonal or a chemotherapy. If there's complete or partial response, then after just eliminating the whole of the systemic disease, you go for the surgical therapy and you keep your patient on a regular follow-ups, okay? So in case of no response to therapy, you have to consider the alternative therapy, and then you have to individualize local regional therapy to such patients. Okay, so in case of the advanced local regional breast cancers, like stage 3A and stage 3B tumors, the option is like you have to go for surgery and you have to combine with a radiotherapy and a chemotherapy in case of stage 3A or stage 3B tumors, right? But in case of the advanced tumors, like stage 4 distant metastatic disease, then you don't have to go for surgery, and just you have to, if the patient has already developed a fungating mass, then obviously you have to go for toilet mastectomy. The curative surgery is not the option in such cases, and just you have to treat your patient on the endocrine therapies. If hormone positive, then you can put the patient on Herceptin or other hormonal therapies. But if the receptors are negative, then you can do is the chemo and the radiotherapy.